Welcome to this course titled Discharge Planning for Nurses, Ensuring Safe Patient Transitions. It is a focused course by Revolve Staffing aimed at helping nurses learn the art and science of discharge planning, ensuring every patient transitions safely from hospital to home. Discharge planning is a critical nursing competence that directly impacts patient safety, quality of life, regulatory compliance, and health system efficiency. Effective discharge planning begins early in the care process and ensures patients and caregivers understand medications, follow-up care, warning signs, and available supports, reducing the risk of complications and readmissions. By addressing clinical, functional, and psychosocial needs, nurses support safe transitions, promote independence, and enhance patient confidence after discharge. Clear communication and thorough documentation also ensure compliance with professional standards and organizational policies. At a system level, strong discharge planning improves care continuity, reduces length of stay, and supports efficient use of healthcare resources. As nurses, we play a central role in ensuring safe, effective, and well-coordinated discharges. Discharge planning is not a task reserved for the end of a patient's stay. It begins with our first assessment and continues through every interaction we have with the patient and care team. Early identification. Through ongoing assessments, nurses are often the first to identify potential discharge barriers. Changes in mobility, cognition, social supports, or medication complexity are issues we recognize early at the bedside. By identifying these needs promptly, we can initiate planning early and help prevent delays, readmissions, or unsafe transitions. Team coordination. We act as key coordinators within the interdisciplinary team. By communicating patient needs, progress, and concerns to physicians, allied health professionals, and community services, we help ensure that discharge plans are realistic, timely, and aligned. Our role in facilitating collaboration is essential to continuity of care. Patient and caregiver education. Patient education is one of our most critical responsibilities. We translate clinical information into clear, practical instructions related to medications, treatments, activity limitations, and warning signs. By confirming understanding and involving caregivers, we empower patients to manage their care confidently after discharge. Clear documentation. Our documentation supports safe transitions and professional accountability. Clear, accurate records of discharge plans, education provided, referrals made, and patient understanding ensure continuity across care settings and meet regulatory and organizational requirements. Through early assessment, coordination, education, and thorough documentation, we as nurses directly influence patient safety, recovery, and successful transitions beyond the care setting. A simple framework to ensure patients comprehend all essential information before leaving the hospital can be referred to as the 5 Ds of discharge. These stand for diagnosis, drugs, doctor, directions, and diet. Number 1, diagnosis. Ensure the patient clearly understands their medical condition, what happened during hospitalization, and what to expect during recovery. 2, drugs. Patient should know all medications, proper dosages, timing, potential side effects, and when to seek help. Doctors are the 3rd D. Patient should have contact information for follow-up providers and know when and why to schedule appointments. Then we have directions. Every patient should know all care instructions, activity limitations, wound care, and warning signs to monitor. And finally, diet. The patient should have a good understanding of dietary restrictions, nutritional recommendations, and how diet impacts their recovery. Let's talk about the step-by-step process for discharge planning. The first step is to evaluate patient medical needs, cognitive status, home environment, available support systems, and potential barriers to recovery. Next, develop an individualized discharge plan incorporating multidisciplinary team input, patient goals, and family involvement. Then, educate the patient and caregivers and also arrange necessary services such as physical therapy, durable medical equipment, and home health. Lastly, confirm patient comprehension using teach-back methods, verify readiness, and ensure all resources are in place before discharge. Effective discharge planning requires navigating common challenges such as communication gaps, complex care needs, patient resistance, and limited resources. areas where nursing judgment, teamwork, and patient advocacy are essential. To bridge communication gaps, adhere to established standardized handoff protocols and clear documentation. Patient resistance can be handled by addressing misunderstandings, cultural barriers, and anxiety through empathetic communication and family engagement. Challenges with complex care needs can be managed by coordinating multiple services, including therapy, nursing, equipment, and specialty care to ensure seamless transitions. While navigating financial constraints and resource availability by connecting patients with community programs and support services can help with managing limited resources. Let's take a quick walkthrough of discharge planning for an 85-year-old patient with diabetes, heart failure, and recent hip surgery, requiring comprehensive discharge coordination. On day 1, assessment is carried out. The need for home health, medication reconciliation, and caregiver training for wound care and mobility assistance are identified. On day 3, physical therapy is arranged, medical equipment delivered, follow-up appointments with cardiologist and primary care are scheduled. Caregiver is trained on medication administration, wound dressing changes, and mobility support using teach-back method on day 5. And on the discharge day, you would have the patient successfully transitioned home with all services in place and comprehensive care plan documented with the expected outcome, been no readmission within 30 days. A patient satisfaction score of 9.8 out of 10. Successful wound healing and improved functional status. In order to ensure safe patient transitions, nurses need to be familiar with available tools and resources. This includes electronic health record systems, tailored educational resources designed for various literacy levels and available in multiple languages, readiness checklists, and digital communication tools for real-time multidisciplinary team coordination and care transitions. Effective discharge planning is not just about sending patients home. It's about ensuring they thrive once they get there. To ensure this always happens, start early by beginning discharge planning at admission and anticipating needs before they become barriers. Communicate clearly by using teach-back methods and plain language to ensure patient understanding. Collaborate actively. Partner with care teams and community resources for comprehensive support. And lead with confidence, knowing that your expertise is vital to patient safety, recovery, and quality of life. Thank you.